In this histological slide of the lung, what we see are these organizing thrombus, fat globules, as well as hematopoietic stem cells. Now, this histological slide is going to be an example of fat embolism syndrome. Fat embolism syndrome is most commonly going to occur due to a pelvic fracture or a long bone fracture. Now, here is an example of a long bone, and when there's a fracture to the long bone, what can happen is these fat globules can then be dislodged into the lungs. These fat globules can combine with red blood cells as well as platelets to form these aggregates that can occlude vasculature in the lungs. And this occlusion of the vasculature in the lungs can then prevent appropriate gas exchange from occurring. What this can cause is respiratory distress. Sometimes these fat globules are so small that it can pass from the lungs into the systemic circulation, where it can then travel to the brain, causing neurological impairments, then to the skin, causing a petechial rash. So this is the triad that we need to be familiar with fat embolism syndrome: respiratory distress, neurological impairment, and petechial rash. Now let's do a question. A 30-year-old man is hospitalized due to trauma he sustained during a car crash. He subsequently develops worsening dyspnea, confusion, and ultimately dies. Autopsy shows scattered petechia on the anterior thorax. Evaluation of his pulmonary vessel shows this histological image. Which of the following predisposed this patient to developing this histological abnormality? Now, this is a classic example of a fat embolism syndrome. The patient has respiratory distress and dyspnea. He has confusion, which is going to be neurological impairment due to the fat globules reaching the brain, and some petechia due to the fat globules reaching the skin. And as we said earlier, fat embolism syndrome is most commonly going to be occurring due to a long bone fracture, which happens in this patient due to the car crash. It's not going to be B, thrombosis in deep veins, because this is pulmonary embolism, and with pulmonary embolism, what we can expect are these coagulative necrosis and hemorrhage due to ischemia. So the answer is going to be a long bone fracture.